Hello students, this is Dr. Gonzalez. I hope you're having a good day or a good night when you're watching this video. Today we're going to talk about the following topics, and let's just go ahead and get started. Let's go ahead and discuss the neck triangles. In order for us to do that, we actually need to draw them first. So this is what I want you to do. Find a piece of paper and I want you to start drawing things with me at the same time. Let's go. Okay, so what I'm gonna do now is I'm gonna start drawing the triangles. It's not gonna make any sense at first, but then I'm gonna explain why we're doing this triangle. So these triangles are some imaginary lines that we can draw in the human neck based on certain muscles that we have in the neck. So for example, posteriorly here I have drawn the trapezius, and more laterally and towards the anterior part you got the sternocleidomastoid. You can also see the omohyoid, digastric, and stylohyoid. First thing is that we're going to draw the margins of what we call the posterior triangle and the anterior triangle. Posterior triangle is pretty simple. If you look at your trapezius, it'll be a line here on the anterior border of the trapezius. There's another line of this triangle passing over the clavicle, and then another line on the posterior border of the SCM. That space right there is considered your posterior triangle. Next, we're gonna do the anterior triangle, also looking at the SCM. So we're gonna start in the anterior border of the SCM. So you're gonna make a line along the border here of the SCM. You're gonna make another line. This one, it'll be an imaginary line in the midline of the neck. So imagine it's like right in the middle of the neck. And then another line on the border of the mandible. That makes your anterior triangle. Now this anterior triangle at the same time can be subdivided into a couple of other tiny triangles within this big triangle. So I'm gonna delete these lines and I'm gonna use another color. I'm gonna use green this time around. So first things first, I'm gonna start with the one small triangle that we call the carotid triangle. Notice that over here we have the hyoid bone. So you're gonna make a small line here also along the anterior edge or border of the sternocleidomastoid. You're gonna make another line in the border of the superior belly of the omohyoid muscle. And then you're gonna make another line passing along the line of the posterior belly of the digastric. And so this is gonna be your carotid triangle. Next, I'm gonna make the submandibular triangle. Submandibular means it's gonna be inferior to the mandible. So if you look over here, you're gonna make a line along the edge of the mandible. Then you're gonna make another line along the edge of the anterior belly of the digastric muscle. And then you're gonna make another line on the edge of the stylohyoid. This right here, it's gonna be your submandibular triangle. And then we also have a muscular triangle and a submental triangle. I'm gonna go with the submental first. To find the submental triangle, you're gonna look at again at the anterior belly of the digastric muscle. So you're gonna make a line along the border of this muscle. Then you're gonna make another line right in the midline of the neck. It's gonna be an imaginary line. And then you're gonna make another line along the edge of the hyoid bone. This particular one, it's called your submental triangle. And lastly, like I said before, we have a muscular triangle. To find it, you're gonna make a line on the anterior border of superior belly of the omohyoid muscle. More or less, it's not a very straight line, but you get the idea. You're gonna make another line in the midline of the neck, and then a third line anterior to the sternocleidomastoid. And that right here is going to be your muscular triangle. Now let's go over the structures in the neck. First of all, in the neck, there is a cervical fascia, which consists of connective tissue that supports muscles, vessels, nerves, and the viscera of the neck. And it has a couple of components. It has a pretracheal layer and a prevertebral layer. The first layer, it's more superficially located. It completely encircles the neck like a collar, splitting it to enclose the sternocleidomastoid and trapezius. Like here, for example, that was the trapezius right there. And it roofs over the anterior and posterior triangles. The pretracheal layer is located in the anterior part of the neck, which you can see right here. It encloses the infrahyoid muscles, the thyroid gland, the trachea, which is the one you see in purple right here, the esophagus, the larynx, and the pharynx, and it's posterior to the pharynx and the esophagus, and it is known as the buccopharyngeal fascia. And then the prevertebral layer, which is located in the posterior part of the neck, it's gonna surround the cervical vertebrae and the anterior lateral and posterior vertebral muscles. Now let's talk about the specifics within each triangle. We're going to start with the posterior triangle of the neck. So let's go over the boundaries. So remember, the boundaries of the posterior triangle include anteriorly the posterior border of the sternocleidomastoid. We have the anterior border of the trapezius, which is right here, and the middle 1/3 of the clavicle. It is covered by skin, superficial fascia, platysma, which is another muscle, and an investing layer of deep cervical fascia. The floor of this triangle is going to be the splenius capitis, the levator scapula, scalenus posterior and scalenus medius. A small part of the scalenus anterior may be present in here, but it is usually hidden by the sternocleidomastoid. And the inferior belly of the omohyoid is going to cross the inferior part of the posterior triangle, and it divides the posterior triangle into an occipital triangle, which is going to be above it, and a supraclavicular triangle, which is below. So that'll be this. Now, let's talk about the contents of the posterior triangle of the neck. So in this model, we're going to start with the arteries. First artery we're going to see is the subclavian artery, specifically the third part, which is that structure over here. We're also going to see transverse cervical artery, the suprascapular artery, the dorsal scapular artery, which is this one right here, and also the occipital artery, which we cannot visualize on this particular model. Regarding the veins, we can see the external jugular vein very clearly right here in blue, and its tributaries, as well as the subclavian vein in some occasions. The nerves we're going to see, it's the brachial plexus, for example. This is specifically the upper trunk of the brachial plexus, and branches that are arising from its roots and trunks. We're also going to see the accessory nerve and branches of the cervical plexus. For example, these branches right here. We're also going to see some cervical lymph nodes. For example, here in green and now blue, we can see some of those along the course of the accessory nerve and the transverse cervical vessels, and also the inferior belly of the omohyoid muscle. Now let's go over the anterior triangle of the neck. We're going to start with the boundaries. Okay, so anteriorly we're going to have the midline of the neck, as I said before. Posteriorly we're going to have the anterior border of the sternocleidomastoid right here. And superiorly, it's going to be the inferior border of the body of the mandible. That makes up your anterior triangle of the neck. And some of the subdivisions, as I mentioned before, it's going to be the submandibular or digastric triangle, the carotid triangle, the muscular triangle, and the submental triangle. And if you want to learn more about this information, go ahead and click on the link on top of this video. And that's it for today. Thank you for watching, and we'll see you in another moment. Here's my dog, Maya. Maya.